States are developing their distribution plans for a COVID-19 vaccine, so they'll be ready when one is approved.
Health officials are considering what barriers could arise when their rollout strategies kick off.
Among Kentucky's list of concerns are administration fees. LEX 18's Sophia Millar explains how even a small fee might hinder the state's efforts to contain the disease. That's tonight's big story at 5:30.
The CARES Act requires employer-sponsored health insurance pay for a future coronavirus vaccine, but uninsured Americans fall through the cracks. Even if vaccine providers don't charge for the vaccine itself, they can charge an administration fee.
These administration fees are to cover the small amount of time that a healthcare provider needs to administer the vaccine.
The Kentucky Department for Public Health tagged administration fees as a distribution barrier in its initial draft plan submitted to the CDC. These fees serve as financial incentives for providers to offer vaccines. Though they'll likely be capped by the federal government, Ben Chandler says any charge will hinder efforts to get the entire population vaccinated.
I know it will dissuade people. There's no doubt about it. And that's why we should not have that barrier. I mean, I just think it's important that that barrier be removed in one way or another. And it can be removed by the private providers absorbing the cost or by them being reimbursed for it by government.
Health economist Teresa Waters explains though the fees tend to be small, even charging $10 could be too much to ask from a family struggling to survive financially.
They may focus on food and rent. And this would simply fall below the line.
According to the Commonwealth's vaccine plan, organizations and agencies partnering with the state health department cannot charge administration fees. It's not yet clear how much private providers will be able to charge or if the federal government will foot the bill for any administration fees. Sophia Millar, LEX 18 News.